Engage Consult is Total Triage ready. Here's how. Using the Total Triage feature with Engage Consult will provide a single platform to manage all your demand, clinical and admin, irrespective of where the demand comes from, the digital or the telephony channel, ensuring equity of access for all. It will improve the consistency of your patient's journey and experience, and patients will be treated the same no matter how they approach you for help, even if they're not digitally enabled or savvy. And it will improve patient data ahead of time, giving you greater time to plan, as with digital access. Step 1. Customising your Total Triage settings. Before we begin using the Total Triage feature, we'd want to just check on the settings that we have in the system. So you go over to your management console. You would go to Total Triage here, and you can see my system is set up to ask patients a set of custom questions. So I'm going to show you that we can untick those, so you don't have to ask the patients any questions at all. You can just leave that for the care navigators to submit a request without asking any questions, or you can select this option just to ask them, and we can save it there. We can also check what those ICE questions are, and we can select the questions that we want to ask in that journey by editing the questions here. You can also remove them. You can also say whether you want the question to be mandatory so that it can't be skipped. So you have the power to decide how your Total Triage route actually goes for patients. To recap, you can decide if you'd like to ask patients the custom ICE questions or simply submit a request, no questions asked. And you can also edit the questions which are asked and decide which are included in the journey. Step 2. The Total Triage patient journey with custom questions. To create a request on a patient's behalf whilst you're on the phone, we can use the Engage toolbar, which you can find here within the client. Depending on the settings of how your toolbar is displayed, you can also create a request from here. We'll be asked, is the inquirer the patient, or are they contacting you on someone else's behalf? But we'll say yes. And you can ask them their last name and their first name, but you can just enter the first letter if you wanted to, and then hit the search option. So we're looking for Jenny Johnson here, and we can see that Engage has searched the clinical system and pulled up the relevant options. So we'll go for Jenny Johnson there. And we can pop a telephone number in so that we know how to reach Jenny when it's time for her turn. So we'll hit next. And we'll say it's medical. And she'll say, I've got a headache. I need to speak to someone. So we'll search for headache. And we'll say, yes, this is a new problem. It's been about 72 hours. No improvement. Pain not getting better. And we'll then ask Jenny, what do you think may have caused this? Say, not sure. Could it be hormonal? And then, are you taking any medication? We'll say ibuprofen, but not helped. How would you like us to help? To speak to the GP. And if there's anything further, we do have the option to type that in as well. And we can prioritise this now based upon the answers Jenny's given. But if the person taking the call doesn't have the skill set to do that, we can leave it as unprioritised. But it could be just put onto same day. And we can assign the request there and then to an appropriate colleague. We can also assign it to a team inbox. So this one could be routed directly to the doctors. We've also got a dashboard here which shows us if we're wanting to assign it to a person who's got what to deal with at the moment and how many requests that person has completed. So that will give us a bit of help if we need it. But we'll stick with the doctors here and we'll hit submit. Then we will go off to the request page, and there you can see the headache request, which has been marked as same day for a patient that's been verified against the clinical system, as it has that tick. And we can see here that we've got the telephone number. We can review the request and we can give Jenny a call. And we can maybe make her an appointment if she still insists that she needs to see someone, or we can give her some advice. We could then pop a status on the request. And also we could send this to clinical. So if we feel like we've satisfied this request already, we can send it to the clinical. Maybe the doctor would do this once they've seen to the request, but we can send to the clinical here by editing these options. We can put the method and the outcome in. We can add any additional clinical codes, and we can decide whether we want the questions to go into the system and hit send to clinical and complete. To recap, you can select create request from the request page or via the floating desktop toolbar. You can search for the patient who can be matched directly from the clinical system in one click. And you can ask for a mandatory contact number to enable patients to be contacted, as all Total Triage requests come through as guests. And you can prioritise and route immediately to the correct person or team. Thank you. If you need a little extra help from the Engage team, email training@engagehealth.uk.